This morning, we're going to talk about a very important issue for families watching this morning, and we're talking about marijuana and teenage use, kids use. Is this kind of increasing these days? Is this something that parents really need to be on the lookout for?
It really is. It really is. At Dacco, we treat a lot of different types of patients. We treat adults and adolescents. And I'm seeing a lot of issues with marijuana in the community. And so I'm here this morning to talk about how you might recognize a teenager in trouble with marijuana. So if you have an adolescent and they have a change of friends,
okay, all right,
in their academic performance, they become kind of defiant with the parent. They have a real change in their personality. If you're seeing any of these warning signs, talk to your adolescent about it.
Which I think some parents are afraid to do. They don't know how to dive into that, but they need to get over that, right, Doctor?
Exactly, they do. And at Dacco, we offer a free substance abuse evaluation for any adolescent that might be having trouble with substances, marijuana or any other substance. And you can contact us for help.
Yeah. Well, and then I guess when it is, what is the dangers with marijuana and teen use? Because I think this drug is talked about a lot, but there are special dangers just when it comes to youth.
So about 1 in 9 adolescents that, first of all, it's the initial drug of abuse for many people. And it starts in the adolescent years, frankly, because of it's readily available, okay? And so about 1 out of 9 individuals that start using marijuana regularly in adolescence will eventually develop a substance use disorder where they continue to use marijuana and or other substances despite negative consequences.
So you kind of hear that gateway drug. Is that still kind of the case? I remember hearing that when I was younger, but that's still the case, yeah.
For many people with an addictive disorder, they started with marijuana. So that is a fact. People that smoke marijuana regularly don't finish high school as often. They don't reach their goals. They don't graduate from college as often, so they don't reach their potential. Academic performance and truancy are also issues in adolescents that use marijuana regularly.
Okay. So if a family is watching this morning, parents are watching, they think, okay, I'm noticing maybe some of those warning signs. What do they do? Where do they go?
Well, the perception, especially with the legalization movements, is that marijuana is kind of a benign drug. It's not as harmful. Marijuana does have negative consequences. If you have used marijuana regularly, you're more prone to develop mental health disorders. And if you have mental health problems, depression, anxiety, they're harder to treat. Also, cognitive performance decreases over time. There have been well-controlled clinical trials that have shown that people who use marijuana regularly through their adolescence into their early adult years, when their brains are still developing, our brains develop until we're 25 years old. You interrupt that potential when you use marijuana regularly. So
the message, I think, is parents watching, let's go ahead, let's do something about it now, address it as soon as you can. As we close here, again, if someone wants to get in touch with your office, is it better to go in, pick up the phone and call? What would you have them do?
Pick up the phone and call Dacco. And you can come in anytime, Monday through Fridays, for a free assessment. But also you can call and learn about our free assessment for adolescents. We'd love to help.
Well, Doctor, thank you so much for being here this morning. I hope we can save some families, some kids, get them going in the right direction. It's certainly very important. Thank you for what you do in our community. We appreciate it. And again, for more information on addiction or how to get help, you can visit Dacco at the address there or visit their website.